Hi everyone, my name is Nisha Chaudhary and I am a PhD student at Jamia Millia Islamia University, New Delhi, India. Today I am presenting my PhD research work which is entitled as Grade Level Classification of Oral Squamous Cell Carcinoma from Digital Pathology using Ensemble Deep Learning Algorithms. Oral cancer affects around 3 lakh people every year from different countries, especially South Asian countries where people have habit of chewing tobacco, pan, gutka, etc., due to which several pre-malignant and malignant condition arises. Then, as we all know, most of the cancer conditions, the diagnosis of most of the cancer conditions is done by the histopathologist based on the tissue samples. Now, to do the diagnosis of oral cancer, they also perform the similar kind of, they take the tissue biopsy samples and they analyze it under the microscopy to perform the final diagnosis. But where comes the problem is when there happens inter-observer variation or there are overlapping features between the different disease conditions. Like one of the condition is oral submucous fibrosis, which is a pre-malignant condition, oral epithelial dysplasia, it is also one of the pre-malignant condition, and then oral squamous cell carcinoma, the malignant condition. Due to the overlapping features between these conditions, histopathologists face difficulties in performing the diagnosis. Hence, when we found a problem, we look for a possible solution, and here we comes with a research question: can an artificial intelligence based oral cancer diagnostic tool using histopathology images assist pathologists in precision diagnosis, which means a diagnosis performed by the doctor can be integrated with a diagnosis performed by the algorithm to provide a precision diagnosis to the patients. To proceed with the research study, we collected the samples from the 5 different institutes across the country, Indian subcontinent, which includes the name of the following institutes like FOD JMI New Delhi, MAIDS New Delhi, AIMS New Delhi, BHU Banaras, IUMS Ranchi. The samples were collected in the form of tissue samples and also in the form of a digital pathology images. After the collection of the samples, they were stained with an H&E stain dye, and then the digital images were collected at the 100x magnification using the routine bright field microscopy. This is a representation. This is a representation of the normal OSMF and OSCC at 100x magnification. After collecting the images, we proceeded with the image pre-processing steps, which includes the stain normalization, random cropping in the patch size of 300 and flipping in the horizontal and vertical direction to increase the amount of data to given as an input to the machine learning model. The type of machine learning model we constructed, this is the schematic representation of an ensemble deep learning algorithm, which represents that when we give an input image to this algorithm, it will pass on to model 1 to perform the diagnosis of normal and OSMF. But if the image belongs to OSCC, it will again pass to model 2A and 2B to give the stage specific diagnosis of oral squamous cell carcinoma, that whether the input image is well differentiated OSCC, moderately differentiated OSCC or poorly differentiated OSCC. Now we started with the model training. We have chosen a convolution neural network which is specially designed for image data set. These were the number of images collected from to each category, normal, OSMF and OSCC. In total 1,80,000 around images were used to train the model. You have selected around 8 pre-trained models, and out of these 8 pre-trained models, Inception V3 outperformed with an accuracy of 0.999 on test images. On the right side shows the confusion matrix for Inception V3, accuracy graph and the loss for Inception V3. After the training of model 1, we move on to model 2, which is the stage specific diagnosis of oral cancer, that is well differentiated, moderately differentiated or poorly differentiated. For this, we have taken around 2,86,000 images in total. We divided the data set 80% for training and rest 20% for testing. Again, we have selected the 8 pre-trained models, and out of these 8 pre-trained models, Inception V3 again outperformed but showed a very least accuracy of 0.69. As you can see the below confusion matrix, the model was able to correctly predict within the moderately differentiated and poorly differentiated, but it was getting confused in between well differentiated and moderately differentiated. That was the point when we decided to incorporate ensemble deep learning algorithm. On the right side is the pipeline for the same algorithm, in which we thought to insert another model, model 2b. First, the model 2a will differentiate and give output as of poorly differentiated. Then the rest in output will become as an input to training of the model 2b, where it can now differentiate between the well differentiated and moderately differentiated. After the training of the model 2, we perform the 5-fold cross validation test. For this, we use an entire data set of 2,86,000 images, and the rest 20% data set was reserved for internal validation. The below confusion matrix shows the test results for internal validations data set. We are yet to perform the external validation, because that will provide us with more insights about the deployment of such machine learning models in clinical practice. And in conclusion, I would like to say that diagnosis of most of the cancer cases is based upon histology evaluation, and it's the high time to bring new solution to this traditional approach by integrating artificial intelligence with human intelligence. Visualization and interpretation of the final model using model interpretation algorithm will let us know exactly which part of the image helped in prediction of the disease. Lastly, I would like to acknowledge my team, which includes cancer biology group, computational group and oral histopathologist group, including the funding agencies, for helping out this project. Thank you very much, and also to the RECOMB team for giving me an opportunity to present here. Thank you very much.
Okay, thank you, Nisha. So we had a nice digital pathology work. So any questions? Yes.
So thank you for the talk. I might have missed it. Did you train the model in cascade, the two parts, or did you train them one after each other?
Yes. So lastly, we will concatenate both the models 1 and 2. It will be one single model, will classify normal, OSMF and OSCC with stage-specific diagnosis.
Okay, thanks.
Thank you.
I have one question. So you showed that you guys are getting crops, right? And that's random cropping that you guys took?
Yes.
So do you think there are some overlapping areas that you are also capturing in your cropping?
So we did an overlapping of 10 pixels.
Okay.
Yes.
So do you think that can be a problem for your model? If you, let's say, if you separate a non-overlapping regions, just like separate cropped areas, do you think that might improve your model?
Maybe I'll take it as a suggestion. I'll also work on it. Thank you.
Any other questions? Okay, thank you.
Thank you.
We're going to move on to last talk.